Well, hello, everybody, and welcome back to our channel. Today, I have a special guest, and we're going to be talking about fasting and the benefits of fasting on our health. But there's a special focus on this particular talk today. I have with me Rebecca Parker. Rebecca is an amazing woman who holds multiple degrees that we'll go through in a minute, but she is the creator and owner of a company called Fasting After 50. And it's designed especially for women who are 50 and older who are trying to reclaim some vitality in their life. So, Rebecca, it's very nice to meet you. And I'm so happy that we connected a few weeks ago. I just wanted to run through your list of degrees, and then I'm going to let you kind of have the floor to finish out the intros because, man, you've got a bunch of stuff here. You hold degrees in nutrition, in homeopathic medicine. You have a doctor of naturopathic medicine, and then you've done additional studies in things like brain chemistry, heart resiliency, and genomics. And on top of that, you're a certified yoga breath coach. And it just leaves me sitting here wondering, what do you do in your free time?
What free time?
You're right. uh, so welcome and thank you for being with us. Your background speaks for itself. And can you tell us a little bit more about your career? I know that you were practicing as a naturopathic provider for many years.
Yeah, so I had a practice in Seattle, a brick and mortar naturopathic practice in Seattle for many years. And yeah, before that, I did holistic nutrition.
Okay, very good. And so, what ultimately inspired you to start fasting after 50?
Well, really, it was my own menopausal journey that inspired me. As you said, I have decades of experience in health and wellness, and I was really surprised that when I went through menopause, I was already eating well and exercising, and I still gained 20 pounds seemingly overnight and couldn't fit into any of my clothes. I had to get plus size clothes and started
Mhm.
having foggy brain, forgetful, not sleeping well, just feeling tired and run down all the time. And I just really wasn't satisfied with the answer, well, that's just part of getting older. And I really wanted to figure out how I could shift this for myself and ended up learning how to heal my metabolism through intermittent fasting and had a lot of success with that. I ended up losing 30 pounds, so I'm 10 pounds lighter than I was before menopause. And my
Wow.
brain fog also cleared up, and I also started sleeping better, and my energy was better. So it really helped all of those things for me, and I was really excited about it. So I started teaching other women how to do that and ended up developing a 12-week holistic lifestyle and intermittent fasting program specifically geared for women in their 50s.
That's fascinating. As a longevity physician, I always love to hear the stories about how we can start to heal things on the cellular level, and then you
Mhm.
start to see that in the way your physiology plays out. So you get these tangible benefits: weight loss, reduction of brain fog, or resolution of brain fog. It's just incredible to see that we often hold the keys to our own health and wellness, and that we're the cure that we're looking for.
Yes, absolutely.
Yeah,
I
yeah,
100% agree.
yeah. So you mentioned that this really benefits women over 50, but can you just give us a little comparison and explain a little bit more about 50 and over versus somebody in their 20s, 30s, or 40s?
Sure. So after age 50, people will tend to become more insulin resistant. So, which means your body isn't responding as well to the hormone insulin as it used to. And to compensate for that, our body starts making more and more insulin. And this will lead to insulin resistance, which actually puts us, as you know, Dr. Jones, at higher risk of diabetes, heart disease, and dementia.
Mhm.
And what goes along with that is often an increase in visceral fat. A lot of people will call this belly fat, but it's the fat around our organs. And so those two things often come together, and both of these things can be helped by intermittent fasting. Another change that happens as we get older is our mitochondria start not to work as well, and we produce less cellular energy because our mitochondria is what makes energy for our cells. And fasting can really help with that as well. also our bodies get to be less efficient at getting rid of cellular waste. And so waste products start to build up in the cell, which can lead to inflammation and symptoms like brain fog, fatigue, joint pain, things like that. And one of the things that fasting does that I love is it stimulates autophagy, which is our body's own process of clearing out our cellular waste. And we can actually increase that with fasting. And it does naturally go down with age. So we can counteract that tendency with the fasting and really help those inflammatory symptoms that I just mentioned to improve as well. So yeah, we also, when we get older, we're at more risk of cognitive decline. And
Right.
fasting has been shown to increase BDNF, brain-derived neurotrophic factor, and that can really help the health of our brain. And it also can improve the brain fog. And another thing that fasting can do is when we start to make ketones, the brain fog will also be helped by the ketones. So there's a couple of mechanisms that the brain fog can improve from fasting too.
Yeah. Yeah, it's like the list just goes on and on and on whenever you start really getting into the science and the clinical practice of fasting. Yeah.
Yeah.
And that's probably why it's become such a popular thing, right? I mean, if you hop on Instagram and start scrolling, you're going to see things about fasting and different people and influencers talking about it. And I'm sure in your practice that you've come across people making kind of some mistakes along the way. Are there some common mistakes that people trying this on their own tend to make that you might give us a heads up about?
Sure. Yeah. One of the biggest mistakes I see people make is not eating enough protein. And I'm a huge proponent of holding on to our precious muscle mass as we age, because if we do nothing to fight against it, we're losing about on average 1% of our muscle mass every year after 50. So you think about that, by 80, you have lost 30% of your muscle mass, and that's what makes us frail and more at risk of injuring ourselves when we fall and ending up in nursing homes and not able to take care of ourselves. So I think of muscle mass as the currency of longevity. I think it's really precious and we need to try to hold on to it. So sometimes when people are not eating, so the things that we can do to counteract against losing muscle mass are increasing protein and strength training. And so
Okay.
I really feel like it's important to do those along with fasting. If we just do fasting by itself, we are at risk of lowering our muscle mass, and we don't want that. But I can say for myself, I started fasting and strength training and increasing the protein in my diet all at the same time, all after age 50. And I have now more muscle mass than I've ever had in my life. So it's entirely possible to
Okay.
increase your muscle mass and be fasting. I think people have the misunderstanding that you're giving up that by fasting, which is not true at all.
Yeah.
Um,
So without any intervention, it may be a necessary thing, but with appropriate intervention and a lot of this stuff, things that we can do just with our lifestyle, it can make a big difference.
Yeah, yeah. Another mistake that people make is fasting when they're sleep deprived or under chronic stress, and that can be really stressful for the body. So I don't recommend that.
Okay.
Fasting in isolation, I think it can be really helpful. It can make it easier if you're fasting with a community of people that are also doing it. That's one of the reasons why I started fasting after 50, so people could have a place to all fast together and support each other, and they're all in a similar phase of life.
Yeah, that's awesome. Yeah. So how important are other factors like sleep? You mentioned stress management, and you mentioned, hanging on to muscle mass. Are there other, related topics that we need to make sure that we're paying attention to?
Yeah, so I think water and electrolytes are also really important to keep in mind. We do still need to have the water and electrolytes, so sodium, potassium, magnesium are really
Right.
important to make sure we're having when we're fasting. If we don't, we're at risk of symptoms like headaches, fatigue, muscle cramping, and it's just not as healthy for our body. We're not going to be able to do the detoxification that the fasting will help us if we're not well hydrated and have the electrolytes present.
Yeah, gotcha, gotcha. So you talked a little bit about, what happens at age 50, but what specifically is it that makes women who are menopausal and the aspect of fasting, how does that create differences?
Well, I mean, when estrogen drops, that's when we do start to get more insulin resistance and belly fat. So the two are certainly related. We do see, and that's why many women will notice that belly fat when they go through menopause is because the estrogen dropping can trigger insulin resistance. So other things, the hormonal changes can also really interfere with the hunger cues. So like sometimes the hormonal changes around menopause can make you more hungry or have more cravings. It can also create mood swings, as I'm sure you're well aware of,
Oh, yeah.
that we, and those things can make it more difficult to fast. But I feel like if women stick with it long enough so they can get to the point where their body starts producing ketones, you actually can experience having less hunger and less cravings and more even mood, and you'll get those benefits. But they certainly can make it more challenging at first,
Mhm.
to go through. And sleep is another issue that happens. A lot of women, when they go through menopause, will have issues with sleep. So, sometimes just combining it with the bioidentical hormone therapy to help with the sleep and all of these other symptoms that I mentioned. The hot flashes can interfere with sleep sometimes. So sometimes that combination can be really great to help make the fasting easier for women in menopause.
Yeah, very good. Yeah, I was going to ask you, with that talk about menopause, if you're a proponent for doing hormone therapy whenever you're working with your clients who are menopausal and having these issues with their weight and wanting to hold on to muscle mass, and so that's good to hear. Yeah.
Oh, absolutely. I'm a huge proponent. I feel like, that everyone should have that conversation with their doctor and
Mhm.
hopefully find somebody like you that's been specifically trained in hormone replacement for menopause. And if they are a candidate, then it can be a really powerful combination to do both together as a
Mhm.
really powerful tool for increased health span, really
Yeah.
protecting all of our organs and tissues and having our body detoxify optimally, having great metabolic health. It's a wonderful combination
Yeah.
for
Yeah.
longevity.
Yeah, it truly is. I see it in my own life, and I'm not a woman of age 50, but it works for guys too. And it
Mhm.
certainly impacted my wife and some friends and staff members that do these things together. So a really important aspect of it all. Well,
Yeah.
I wanted to back out just a little bit and kind of get your thoughts on the whole topic of longevity and fasting and where they intersect, or maybe where even they don't. But as you kind of look at the things that are coming out and what we're learning, what gets you excited?
Well, I love all of the testing, so the different types of testing that have been coming out. Just that because we're all biochemically different, and
Mhm.
I think some of the testing is really growing and it's continuing to grow, especially with AI. We can really have some exciting, the future of functional testing is really exciting. And so, but right now we're looking at things like more personalized testing, like just people wearing continuous glucose monitors and
Yes.
seeing like if you have two people wearing the monitors and they both eat the same food, they get different results. And that's really interesting to me that people have these individual differences. I really love heart rate variability as a way to kind of assess a biofeedback tool to use to know that people can see. I mean, it's also can be used to see how you react to foods, but it's also really great tool to have. So that's exciting to me. And I
Yep.
just love doing these different tests of looking at people's sensitivities to foods and chemicals, which are different from one person to the other, the genomic testing, the microbiome testing that's coming, there's just so much that is out there to help us assess what's going on with people. So that's all exciting to me.
Yeah, yeah. I'm pumped about the testing as well. The DNA methylation test to get a biological age is fascinating, and I'm I'm excited because I've done some of these as a baseline, and I'm really excited to see what I look like in 6 months on the inside when I retest after I continue to implement some of these anti-aging practices in my life and lifestyle. So yeah, it's an exciting time, and it's like we learn something new every month, right?
Yeah, yeah,
We're
yes, it's true, it is, and
constantly
I think
evolving.
that AI has really sped that up, and we can, I mean, it would be great if we could use it as a tool to really figure out how to combine different things together. Because I
Mhm.
think that that's, we can't really do randomized controlled studies on how to combine every little different things, but maybe AI could help us figure out, well, what happens if you do with this, and what are the impacts of that? So I'm just interested in that as a
Yeah, yeah. AI
potential.
is changing the landscape for sure. And sometimes you get back, as a provider, I'll order genetic tests and I get back 70 pages, and it's like, oh my gosh, what do you
Uh-huh.
do with all of that information? And AI is now going into that, giving an outline for what the high points are, and then coming up with like some really good practices that a person could put into play in their life and lifestyle that are going to make a difference based on their genome. That's so cool.
Yes. Yeah, it's really amazing how it can combine all this information because we have so much data, from all of this, the microbiome, the genome, all this different stuff. How do we synthesize it all together?
Yeah.
And
Yeah.
I think AI, using AI to do that is really exciting to me.
Yeah, yeah, yeah. There's some really cool stuff out there.
Yeah.
Okay. All right, a couple last questions here, and then I'll let you go. As I know you've got a busy day ahead, but are there any myths about fasting after 50 that you've come across and you're just determined to bust those myths?
Yeah, I mean, I think one is just that fasting is only about weight loss. I think that weight loss is a great benefit of fasting, but fasting is also just a tool for overall increasing our health span. It increases our metabolic health, lowers inflammation, helps with brain clarity, helps with autophagy and sleep and energy. And there's so many benefits that it's really not just about weight loss.
Okay, yeah, I think that's a very important one to talk about. Yeah, for sure.
Mhm.
Okay, and then parting question is, what's one piece of advice that you would give to someone who is just turning 50 and starting to explore this space about fasting?
Well, I think somebody just turning 50, a good piece of advice was to think about herself as a 100-year-old woman and to think about what actions could she do today that'll make her life as a 100-year-old person easier and more pleasurable, and so that she can set herself up to live, an active, vibrant life at that age.
Mhm.
And to find community to help implement whatever changes she wants to make, to have that supportive community around is so, so important. And we all know we just do things better as in when we can support each other through changes.
Yeah, yeah, absolutely. I love that proactive approach. Yeah, that's great advice. Okay,
Thank
so I may have patients that are interested in your 12-week program. If I did, how would I go about getting them in touch with you?
So my website is fastingafter50.com.
Okay,
So yeah, there's a link there if they want to book a free call to talk with me before the program. They can also just start the program. I also have a link for the so they can watch the first module for free. So
okay,
just check it
okay.
out.
So
Yeah.
so fasting after 50, is that how it is? So
Yeah.
fastingafter50.com. Rebecca, thank you so much for coming on. I learn something new every time we talk, and I'm really looking forward to getting to know you better as we help our clients that we may share together on their journey towards a longer health span.
Thank you so much, Dr. Jones. This has been a real treat. I appreciate you having me on, and have a wonderful rest of your day.
Thank you very much. We'll see you later.
See you
Bye bye.
later. Bye-bye.